Okay. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Ladies and gentlemen, today research out seminar organized by QNRF about some of the funded projects on infectious diseases with their relevance and potential impact on the pandemic of coronavirus. Before I start an overview of today's event, I would like to welcome our executive director is joining us here, Dr. Abdel Sattar Ta'i, and I will also welcome the speakers or the principal investigators. These are researchers who carried out these projects, and we call them the panelists. Most importantly, I would like to welcome Dr. Sheikh Mohammed Al Thani is the keynote speaker here. We thank him very much for his time and effort for coming. I'm sure he is very busy in so many activities. He's on the front line. He is the Director of Public Health and Supreme Council of Health in the Ministry of Public Health. I also would like to welcome Dr. Al-Mubashir Faraj and Dr. Mohammed Al-Hajri, the Director of Emergency Preparedness and Response Department in the CDC Ministry of Public Health. I also welcome Dr. Nico Mar. He is the investigator and the group leader on system immunology and immune deficiency from Sidra Medicine. Also welcoming Dr. Goodwin Wilson, and on behalf of him probably will talk Dr. Usama Barashi. Dr. Goodwin Wilson, he is attending emergency room in the hospital. So unfortunately he cannot attend, but for the PI, Dr. Usama Barashi will talk on behalf of him. He's from HMC. Of course, I'm welcoming also Professor Laith Abu Raddad, a Professor of Healthcare Policy and Research, Assistant Dean for Extramural Research Funding, Director of Areas of Concentration Program, and Director of Biostatistics from Weill Cornell Medicine, Qatar. Also, I'm extending my sincere welcome to Dr. Hadim Yassin, Associate Professor of Infectious Diseases, Research Project Manager from Qatar University. I'm also welcoming Dr. Ali Sultan, Professor of Teaching in Microbiology and Immunology from Weill Cornell Medicine, Qatar. And most importantly, I would like to welcome all the attendees from the public who are attending this seminar from all over Qatar. Today's ROS is one of the activities that QNRF hold yearly. We carry about 6 to 8 ROSs every year. Usually we carry it as a physical outreach activity to share the outcome of some selected projects that they have important outcomes and impact with the stakeholder and community at large. But unfortunately today, because of the crisis that we have and the world crisis, the pandemic of the coronavirus, we were challenged to organize this ROS online in the form of webinar. Even though it's so difficult, but as QNRF always up to challenge and its resilience, so we organized this conference regardless of all of the challenges we have faced. The ROS objective in general, as I mentioned, is to share the achievements and outcomes of the research projects, benefits and impacts with the stakeholder and scientific community and public in large. Example of what publications, patents, awards, capacity building resulted from this research. In addition, researchers will also shed light on some of the hurdles and challenges they face and some of their solutions with other researchers. It's important also to highlight the impact of QNRF awards to relevant stakeholders, research community, and public. And that's the time now the researchers to utilize the outcomes of their projects in implementation and for the benefit of the society. It's also important this time is to promote research in infectious diseases and therapies, especially at this time of events of the corona pandemics. And what are suggestions for future research to build on? So these are the important objectives of the ROS in general. Just to give you a few quick slides about the topic of the day in general. Worldwide, the top 10 global causes of disease are very known or similar worldwide, and that are the cardiovascular diseases in general as the first, and second is the lower respiratory tract infections, or what we call them communicable disease in general. Even though worldwide the cardiovascular diseases has been improved, but they still the main challenge. The second in importance is the communicable disease, especially respiratory diseases. If we look at Qatar specifically, Qatar has strongly reduced the burden of cardiovascular diseases, respiratory and communicable diseases. And you see there is a good drop, almost 40% in these from 1990 until 2015, yeah, within 25 years. So this is a very important and good progress. However, there is still progress required in some of these non-communicable diseases as diabetes and mental disorders. However, if you see also respiratory diseases, even though there is a drop in communicable disease, especially respiratory disease, there is always the challenges there, as we notice from these days pandemic. The most common communicable diseases, the top 10, as you see from this screen, are majority of them are viruses, almost 7 or 8 of them almost viruses. And about 3 of them, they are related in one way or the other to respiratory infections. So this also reminds us to keep an eye on communicable diseases and their challenges and their impact on health. This is a good slide that it shares the history of pandemic since a long time in the history. What it tells us indirectly that throughout history, as a human spread across the world, infection diseases have been a constant companion, even in the old era, and outbreaks are yearly happening on regular intervals. As we notice some of these very known familiar examples, as here you see the Black Death in 1347, about 200 million people were died at that time. Smallpox, 56 million people. And as you see later in near history here, what we see is the Spanish flu, about a large number of about 100 million people died in that time. Now at the end, this is the near history from 1950s or like the beginning of 20th century until now. What we see, most of the pandemics are one way or the other respiratory infections that either belong to the flus, like you see Asian flu, 1.1 million, Hong Kong flu, 1 million, swine flu, about 200,000 deaths. And the other family of viruses that also causes pandemics, respiratory diseases, are the corona family, characterized by MERS, SARS, and the one we have now, which is SARS-CoV-19 or SARS-2. It is a worldwide pandemic, and up to last night, about 40,000 people has been died from this pandemic worldwide. And I will leave more details about COVID-19 and the corona for Dr. Mohammed Al-Thani will talk more in more details about this topic today. The ROS agenda for today, as we organize it, as follows. The first speaker will be the keynote speaker, Dr. Sheikh Mohammed Al-Thani, will talk about the corona disease contemporary knowledge and update worldwide. He is from Ministry of Public Health. I'm sure all of you know that. I thank him again for his time and effort and contribution to this seminar. The second speaker will be supposed to be Dr. Ahmed Al-Mubashir. Unfortunately, he is sick and cannot attend this seminar. So on behalf of him, Dr. Mohammed Al-Haji will present from CDC, Ministry of Public Health. He will talk about an important project that was started in 2015. It was a joint collaborative project between QNRF and NIH, and he will share us about the important findings about this project. Then the third speaker will be Dr. Nick Omar from CIDRA. He will talk about a platform for large-scale serological profiling of Qatari population to link individual genome and immune phenotype variation in health and disease. He has a very important findings to share about this project too. The fourth speaker will be Dr. Goodwin Wilson, but Dr. Goodwin Wilson, he's attending an emergency in the hospital, so unfortunately also cannot attend, but the PI on this project, we will talk about it, Dr. Usama Barshid from HMC. This project was funded for HMC, face mask against viral respiratory infection, a clustered randomized clinical trial. And they have important findings that's directly related to the pandemic that we're facing today. Professor Laif Abu Raddad will talk about two important projects and very important findings and research design that are directly related to today's pandemic, the COVID-19. He's from Weill Cornell Medicine, Qatar, as I mentioned. And then the fifth speaker will be Dr. Hadi Yassin from Qatar University. Will talk about influenza complications and the underlying mechanisms in disease pathogenesis in diabetic patients in Qatar. And he will talk about the outcome of another important project, which is estimating the burden of viral gastroenteritis and effectiveness of rotavirus vaccine in young children in Qatar. And the last speaker will be Dr. Ali Sultan from Weill Cornell Medicine, Qatar. Again, he also will talk about two important NPRP projects, human papilloma virus in Arab women, and molecular, clinical, pathological, serological, and vaccine impact studies in selected Arab countries. And then another project titled Polychip, an ultra-high throughput microfluid functional assay strategy for antimicrobial drug discovery. And he will share with us very important findings and some of patent disclosures that he produced. At the end, I would like to acknowledge all of the contributor institutions in this seminar in advance: Ministry of Public Health, CIDRA, Weill Cornell, Qatar University, Hamad, and of course QNRF. I have few notes for the panelists or the speakers. Please abide by your presentation allocation time as much as possible because we have a very limited time. The second, also please mute yourself to minimize external echoes and sounds, and mute yourself when you do your presentation or when you speak. Q&A session will be at the end of the presentation. This is already mentioned in the agenda. And for attendees and public, please write your questions in the QA window and to whom you direct the question, and we will take as much as we can from them and forward them to the researchers to answer your questions. By this, I will thank you, and I will end my session, and I will give the floor now to Dr. Mohammed Sheikh Al-Thani to start his first speech about the coronavirus. Please, Dr. Mohammed, to your podium.
Bismillah ar-Rahman ar-Rahim. Thank you, Dr. Mohammed Jabbar, for this. I would like to send my regards to QNRF for Dr. Abdel Sattar and you and all our colleagues to do this very important meeting during this critical time. It's very beautiful for us to see that all the CDC people who believe in communicable disease are communicating in the middle of the storm that's happening now and the crisis about COVID-19. This tells us that we're going to focus on coronavirus. At the same time, we're going to keep going on with our activities as we prefer not to paralyze the country totally. We need to work properly even from our home. So to start my presentation, I would like to thank our colleagues and QNRF when they worked together a few years ago to assure that CDC is part of QNRF. We have 1 year that CDC was not recognized in QNRF. So we discussed this with QNRF and they recognized this and they said, no, CDC is very important, and we're going to give them a space during our QNRF research, which is now making very valuable, because after these discussions, we got the space and we got to focus on a valuable research that affect the impact of the country and the Arab world, which is becoming more efficient for us. And now I can see the names, the titles, the people who are going to speak. All of the titles are very interesting and much related to Qatar, and some of them are ambitious as we would like from our long vision for QNRF. So I hope that I can see here that CDC is going in the right direction to have the proper community and solidarity and work together with our colleagues from the world to assure we improve CDC in Qatar. Especially you can see, although communicable disease have low deaths in Qatar, but we have still the challenge of our airport that is bringing us any disease anytime from any place in the world, and we need to keep this one, the country protected and our Qatar Airlines well protected to keep active all the time. So regarding today's presentation, I will go with only 15 minutes, inshallah. So what is the main worry of what the debate now about COVID? It's not only the deaths, that this has happened all the time for different reasons. But if the health system collapse and the contamination mitigation suppression doesn't work properly, it will end by having a big chaos in the country. And we can see it very well in Italy. It's like unbelievable what happened in Italy, and we hope that everybody is protected from that, and how America go quickly to be the highest. And the second thing, that people like in Europe, they didn't care much about the deaths as much they are worried about the economic crisis. Even we are still surprised why the minister of Germany has suicide. Does he's complaining from the COVID, or what will happen, the recession that may happen after the COVID? We don't have a clue yet, but it seems that the economic crisis will be more worrying people even after the COVID has been moved on. The deaths, as you can see, it looked like not too many deaths, but the panic that coming from these deaths is much, much higher, and the mental feelings and the people are worried is higher than even the deaths that you can see on the slide. Okay, as you can see, something everybody know how Italy, Spain, and America are leading this one, and UK is coming through this again. And Germany is one of the best countries that do a good job to keep it less than 1%, but now even it's more than 1%. The exponential chart tell you that the cases are going high. Until now, people asking us what will happen. We are not sure till this big wave happening in Europe and America slow down. We can have bigger hope, and we are looking forward to have many hopes, from treatment to other issues. As you can see here in a brief, Qatar is one of the countries that is very transparent. We are the second, maybe highest in the Arab world after Saudi Arabia, because we are transparent. The case around 800 now, because we have three things. We have many Qataris coming from outside the country, 90% of them and more are coming from quarantine, coming from outside Qatar, from all around the world. And we have many laborers that we found blue color that maybe it passed for them from Iran before we closed the border. We are not sure it's Iran or Bangladesh, but we have it in our labor, and we are doing active surveillance to find many more cases. So the test capacity help us to have test capacity, and the brave to be transparent with the people make us in the highest. The death is becoming yesterday too, but you can see now the other worries forever. The market is unbelievable. You know, oil price is lesser than 2002, and even it's not less than 2002. It's even half of 2002 because of the normal inflation of the country. So it's a catastrophe never happened since maybe 100 years. So it's like the global global flights have gone down. There's many airlines now at very vulnerable to close. And even Qatar Airways said that we're going to get support from the government, although USA complained that you should not get support from the government. But it's needed now. We are in a crisis, and everybody is bailing out their companies. Restaurants booking, everybody is closing. We don't know how many people of them will survive. Government will support this restaurant, but they will not give them their profit, but they can give them what there is lost. So coronavirus people are worried, what's coronavirus? And we can see the spread of the coronavirus is like debatable, different sources from 2 to 0.25 compared to others that is higher. You know, measles and mumps and measles and smallpox are higher than COVID, and H1N1 is lower. So the main panic of coronavirus, COVID, is that it spread easily because many people, 80% have mild symptoms or no symptoms, and they spread it without knowing to many people slowly. without knowing, all of a sudden you find everybody have the disease and you get the high peak. So the worries, now, this is debatable. Should everybody say, I'm worried about my kids, while the kids are not dying easily, alhamdulillah, but the worry about the fathers and the parents and the weak people like, so the eldest above 80 are the highest, which we can see very clearly in Italy and other countries that have high deaths. And the heart disease are the most at risk than diabetes, then respiratory. And you can see how much people, the asthmatic around the world, are in panic now. And we are trying to keep this between saving their lives and not giving them a mental stress they will never forget in their life. So here we can go to the basic reproduction number, and we can see the patient zero, how it affects the others. And we are trying to cross the chain by closing everything. And God forbid, we maybe need curfew just to close the spread of this disease. It's clear here how two become two. And this is the chain that we want to close with our draconian measures. So you can see here, this is the risk that we discussed, incubation period for everyone, then the symptoms. And this time, when they have the symptoms, other people start their incubation period. And we are not sure everybody will pass to the immunity, or we will lose some very dearest people for us during this one. And this is giving stress for everyone, not for the person who's gonna die, for the family that's worried about this person too. So here we are trying to assure that control the infection in the community. So we come here, the fatality risk, and this is debatable, the fatality risk, because Wuhan is higher than swine flu, 2%, more than swine flu, but it's less than SARS and MERS. That's high contagious. So the Wuhan novel coronavirus is spreading quickly to the world. So the 2% from millions will be a big number. And we can see now people who died now more than most of the direct wars that happened in the last maybe decades. So, and we are looking forward that we find some solution for this. And the death is again is high. The case fatality is not accurate. Maybe it's 2% looking for us, but I believe it's maybe less than 2%. But many people, they don't know that they are diseased. I mean, if you go to America, they are not only 200,000. There's maybe millions in America. But this is what they only have the chance to test them and get them positive. And but in the end, so maybe less than 2% in my beliefs. But for millions, it will be a catastrophe, and the deaths will go maybe more than between 50 to 100,000. Alhamdulillah, I hope that not more, inshallah. So this is our goal. This is the most important high curve wave that we want to protect. Everybody knows about it now, I think, we are CDC people. But this is what we are fighting to assure that the protective measure works. Qatar have a special situation. You know, Qatar is in a kind of boycott. There's no neighbors to help us if that's what something needed. So we need very vigilant and alert to keep this going in the right way. We are blessed that the government is supporting us totally and giving the health the gold command to get decisions to protect this from happening. And I hope that people are with us in this. And we are doing a great efforts with the embassies, with the charity institutes to give these measures to the labor, the blue collars, to understand that we are doing something to keep the healthcare system working properly, and we lower mitigate risk. God forbid, we have sometimes nightmares thinking that, God forbid, our main hospitals can be infected and put us in a big risk if the hospitals itself are at risk. So, so we said about the social distancing. I will not speak about, but you know how the importance of social distancing here, and we are fighting for this. So we are trying to work on first the containment. It's what happened first when we closed the planes coming from China or Italy or Iran, and to delay it now to control the distance between people and getting many laws for that. And now we are hoping research that from your side that can help us somehow. What is the smarter thing that from researchers like you can help us to break the chain and control from spreading? Everybody is waiting for the high peak of the disease, and we are not sure when is the high peak, because it's still we are delaying it, and we are not sure when is the high. We are hopefully we don't want to go to the mitigation. We can it's not we'll keep working on to make it suppress it as much as we can, but the mitigation maybe will need it, God forbid, if this go on. Great thing, His Highness the Prince and the Prime Minister, everyone is supporting us, and we have transparency and decisions making every 2 days for the people to assure that we go updated with what's happening in the country. So one of the strong decisions that we did stopped the airlines, the Qatari citizens from entering should be quarantined. Whoever is VIP, VVIP, all publication passports stopped. This is maybe, I think, one of the main reasons in Europe it's happening that in New York, the transportation is a great place for super spreaders and groups to work from home. This is for us an upgrade. Everybody now is going to the future. We are all pushed to speak like this, and it is a frustrating time, but it helps us to go to the future in communicating in better way. Schools was closed. It relieves us when we closed. They are not at this stage of dying, but they really not to be this other super spreader for their grandmothers and grandfathers. Economic, supporting the financial in Qatar happened to keep the stress on people economy less, although there is a stress all the time, but at least not to, they will be sick, but not dying from this crisis. Exempting sectors from electricity and water, rents, logistic areas to support the people, and we'll keep adding people when needed for this one. And you can see the BMG best practice, the etiology, the airborne transmission is always discussing here. There's worries. It does transmit about air, through air. People are recommending masks, but nobody can bring masks for everyone. So we are in a thin line to decide who should take the mask and who should not, and how to control the stockpile of masks in the country, so you don't use it early and lose them when you need them at most. So the clinical picture is even in our part of this one, and the treatment algorithm is updated all the time. And Qatar mainly we give oseltamivir, hydroxychloroquine, and antiviral disease for HIV, plus interferon and corticosteroid. So if you go here to the landscape of candidates for vaccine, we are hoping that the vaccine they are expediting the vaccine work, and the preclinical is going on. 2 are in the phase 1 and clinical phase 2. We hope things go faster in vaccine. I think need to finish, so maybe excuse me that I will finish in 3-4 minutes because of the time. Okay, now there's a lot of things. Diamond Princess was done, floating laboratory to understand, and the studies has happened. We are looking from your side here that you take the chance and start research in Qatar for COVID as soon as possible, so we don't lose the value that we can add during this crisis from research. Okay, and WHO and its partners have launched solidarity trials, and we are trying to expedite, to work with them to assure that we can have the value from these trials. We are understanding more the antibodies because we couldn't do a lot of rapid tests. Most of the rapid tests was refused to be buying them in Qatar, and because they are not accurate. And we are trying to find way how to get better rapid tests on working on antigens, or focus on the molecular more than antigen, as you can see. We are hoping that people are giving hope with hydroxychloroquine. Let's see how much it will be effective for everyone. And we are working on COVID treatment protocols all the time. And all the people we are following in Qatar, we are trying to find every case and try to isolate every case in Qatar, not isolate at home, to isolate them in the hospitals. And we are looking forward, not on only hospital, the mild cases can be in a big like compound. We have a compound of 1,200 beds to help the mild cases, and there's a chance to understand more from these places, that we can send some researchers to understand what do they feel and how we can identify the cases even faster. For our conclusions now, I want to finish, is together we need to have a research roadmap. I look forward today that you can find proper researches to do on COVID that add value for Qatar and the humankind. Planning logistic operation is a challenge for us, because when we planned, we couldn't find the logistics. And when we couldn't find the logistics, the operation was not so easy, because to make everyone work together, it's not a very easy job, even in a small country. So we are looking forward to invest more in surveillance, because the best thing that everybody said, test, isolate. So now we're trying to have more surveillance, and every time we make more surveillance, it ends by having more cases to be in Qatar case. And people are worried why our cases are growing, but most of it is active surveillance. Critical preparedness is happening all the time, and readiness, rapid response, and early investigations. We are just increasing the capacity of our labs. It maybe take more than 2,000 tests now. We're looking to work with other labs like Weill Cornell, Sidra, and Qatar University to find a way to get more rapid tests. God forbid, we don't want all the tests to be in one place. It's very risky for any cross-contamination or any accident. So we are trying to build our capacity all together with you. And we manage all the trip from point of entry. Nobody can come to Qatar without being swabbed. We would like to provide and maintain essential health services, and this is a challenge that we are bringing all the Qataris, most of the Qataris are outside Qatar to be in Qatar, because as you may know, we have 2 deaths happening in UK, one of them from leukemia, and then Corona came during the weak immunity, and he passed away, and the other one who was in coma. I think they are very busy in COVID, in COVID and didn't take care about this patient, or he got COVID too, we are not sure. So ironically, the 2 deaths of Qataris from a Corona or COVID are in UK. So I'm preferring people to come to Qatar, but this will overwhelm our system more by bringing them back. Inform the health workers the rights and responsibilities. We are very worried that the healthcare workers don't take the right protection and they become source of infection for themselves and others. And arrange key consideration for occupational safety and health. You know now that any person who died from COVID by ILO, he can be identified as dying at work. So we are trying to protect them and keep them more safe. And deliver the technical guidance for school, workplace, institution, awareness all the time, educating the people what to do. Because if this situation maybe will take some time, I want to make sure that we don't paralyze the country during this period. We are having a big challenge that can you make a curfew for 3, 4 months, 6 months, or the country will have big problems to keep the essential life working on. And we hope that we can get the balance between keeping people protected and at the same time keep the work happening to lower the economical impact for Qatar. Thank you.
Thank you very much for this very nice and informative presentation. This is a great information for all of us. Okay, now we'll move to the Q&A session. I hope all of the speakers or the panelists are available. We have some questions. I will go over them. Okay. Okay, now the QA session, I will go with some of these questions and try to forward it to the person, or any of the panelists can raise hand and answer that question if it's possible. The first question from Abdullah Rajab. Thanks, Dr. Mohammed, for good presentation. I think this is Dr. Mohammed Al-Thani. Want to know the value of the BCG vaccine, which shown promising early results in recent study, or protective effect. What do you think? That's what does he mean? Thanks again. Dr. Mohammed Al-Thani, what do you think about the BCG vaccine here?
Hello, hello, hey, hi, hello. Can you raise your voice? Yes, again the question.
Yeah, what do you know about the BCG vaccine, which shown promising early results in recent study?
Yes, of course, one of our challenges that the BCG that we have now, this is promising. The TB still is one of the reasons of the highest deaths in the world for TB. And we are looking forward that BCG vaccine to come better, but doing research on BCG in Qatar will be difficult.
Okay.
Yeah, it'd be difficult, you know, the community getting the approvals, you know, to start it. And we can monitor the world, but systematic review, but we cannot do it we cannot focus in doing it in Qatar. I think it's not a priority.
Okay, thank you so much, Doctor. They have another question for Dr. Abu Raddad, I think. Are we in Qatar starting any trials to develop a vaccine for COVID-19? Dr. Abu Raddad, this question is forwarded for you.
Okay, no, currently there are no vaccine trials in Qatar, but there are lots of vaccine trials globally. There are actually tens of vaccines in different stages of development being actually tested. Yeah, so I don't think also necessarily we should have vaccine trials in Qatar. It will be actually difficult also to get maybe the incidence that's needed to measure the efficacy.
Okay, thank you so much. Any of the panelists, I mean, I don't see any hands. If anybody wants to make comments about any questions, please raise your hand or let me know.
Yes, Dr.
Yes, Dr. Muhammad Al-Thani, please go.
Thank you. I believe that now for these participants, one of our goals to meet is part of our strategy, research strategy. We have a research strategy for Qatar 2030 done by QRDI. And this strategy is to assure that we do a valuable researches in Qatar which have impact. So now all these eager people who are working on research in Qatar, we saw the presentation, they were very balanced. You know, the research that was done in Qatar is valuable researches. And we are looking forward to upgrade even the very good research that was done to ensure that we make research for Qatar. We protect the budget for CDC all the time in the strategy, but we assure that they have an impact for the communication, the community. I mean, like somebody say, we'll make a treatment in Qatar. Okay, it's an ambitious idea, but can we do a treatment? I don't want to stop the ambitious ideas, but this is a sophisticated thing that will lose years of continuity. Maybe will not end by something much valuable in Qatar. But of us doing a research, how to lower the contamination from Qatar Airways, okay, to the community, this will be more valuable for us because we are at risk all the time from any contamination of communicable disease coming through the crew of Qatar Airways, like example. So we are looking forward that to make a research how to find the people, the blue collar people with infection as soon as possible before they become spreading the infection in the blue collar that we are having the challenge now during COVID. So I will not say every idea of research, but all these smart people here with us, more than 150, I would like to assure that please give us a very valuable research ideas and we will support it totally when it is effective and efficient for our community and the humankind. Thank you.
That's very good. Thank you, Dr. Muhammad. Thank you very much. I have another question from Atif Iqbal asking Dr. Muhammad Al-Thani. Thank you for the wonderful presentation. I wish to know what is the percentage of accuracy of the testing kit we are using in Qatar. So Dr. Muhammad, what do you think?
Okay, we are using now Roche, the test, which is a PCR test, and it is, they see it's like around 100%. I think it's 99, and they are more than 99. I debate, but I was worried that there's some false positive, but it's more than 99. And this is the thing that we are now in dilemma, that our system, because of the quality of accredited system of our labs and our HMC, they prefer always to go for the 100 or 99% accuracy. And till now, we are stopping the rapid test from growing as experience in Qatar, although many people in public health are supporting to have rapid test for the community, especially for the blue collar, to know more cases very fast. We are still in this approval. We get some approvals, but they are debating. They don't want the antibody rapid test. They want the molecular test. We are pushing to get this from Korea or from America, but America, we cannot get anything from America because they are busy. Our people don't want low quality rapid test. And as you know, like Italy and I think Spain, they send back many Chinese rapid tests because they were not accurate except 30%. I'm hoping to have both, to have the PCR, the 99% plus, and we have another thing, because either you need quality, but sometimes you need quantity. So we are pushing to keep the balance. We do both. And we hope that very soon we will have rapid test, but one of the best rapid tests, if we can, approved by FDA, if we can very soon. Thank you.
Okay, thank you so much, Doctor. I have a question from Abdullah Al-Thani. Will we be gaining immunity to COVID-19? I think that's to any of the panelists can answer that question. Professor Ali Sultan or Nikomar can answer any of the panelists. Will we gain immunity to COVID-19 if somebody gets infected again?
So I think studies so far have shown, and most of them are not peer-reviewed yet, but it have been shown that infected people get seroconversion after 6, 7, 10 days, essentially. So it's expected that someone who has been infected has immunity.
So if I may comment on that as well, I think like yes, we know that the infected people will get the immune response, especially antibodies. but we don't know how long these antibodies will last, because we know in case of MERS coronavirus that especially for those that are infected with mild symptoms, the antibody will win within 1 year. So I hope it's not the case with the COVID-19.
All right.
Yeah. Can I add something?
Like,
or so
yes,
yeah?
go ahead.
Yeah. So exactly, just to, as the colleagues were saying, it's likely there is very strong immune response to the virus, which actually controls the infection. There have been some reports that people get re-exposed to the virus, but these are anecdotal, and there are doubts about these cases. It's probably something related with measurement error, rather than actually people being re-exposed. Now, we do have experience with other coronaviruses, and it seems that the immunity wanes between 1 to 3 years. So in summary, it's likely there is a strong immune response that will last for probably 1 to 3 years.
Yes, and I would like to add, Doctor, here, this is a very sensitive issue, because the world is coming from panic to a panic to no hopeless future. You know what I mean? The people are telling them this will not end soon first, because it will keep going on in their community. And after you get immune, after 1 year, you're going to have the infection again, and you have a chance to die. So the world is in a panic, and this will keep coming on as a nightmare for everyone. But in a brief, I believe it looked like that we need to invest in vaccination. You know, we cannot wait till everybody get immunity and get it. Okay, sorry. So this is a thing that I would like to see, that this panic, scientists are saying the right things, that the immunity will go down in 1 year, but people are getting panic, that there is no way to get out of this. So I'm hoping that the investment in vaccine and how to distribute vaccine is very important, and see the adverse effect of it, God forbid, very soon. The same thing that if we are going, people are saying the antibodies will not be effective. We cannot keep all the world in curfew or blocked down for years. We need to find a ways to keep going on with this nasty disease, and to find a way to keep the economy working, because this will end by wars and economic wars if we don't find a way to keep the productivity with proper precautions going on very soon. Thank you.
Sure, Sheikh Mohammed, in comment to that, I have a question for you. I'm sure you have heard about like the proposition in Germany that like they want to give certificate to those that are immune to come back to work. Are you considering that in Qatar? Are you thinking of the same approach?
Yeah, thank you. I think this is a smart idea. We need to know the technique. We mentioned this yesterday in our meeting but we need to know how Germany is doing that. We tried to speak to them earlier to know why they are the best country in the world in controlling the disease, although now they are not the best after they have becoming 1% deaths, but they are the best maybe in Europe as Germany. We would like to learn from them more, but we don't know who's the person to speak with. We are looking forward to the plasma, to help people with plasma, to get this plasma for people and help the other people. The same thing, to identify the immunity, we need to have the rapid test, or to do something away to keep the people who are immune back to work, as you mentioned, because we need the productivity to keep going on. I cannot keep everybody at home for a long time. I care about health of people, but I know that worst thing will happen to the public if the productivity slow down totally. Thank you.
Okay, that's great. Thank you. I have another question from an anonymous person that he is asking to Dr. Mohammed, can you please elaborate on how you will expand operations in Sidra and HMC or Hamad colleges in Qatar? How ready are these institutions? How can medical students be involved or help out in this crisis? Can you please, Doctor?
Yes, in a brief, we focus, I mentioned something yesterday. This was led by Minister of Public Health and mainly HMC. So I said that if we don't use all our resources, we cannot go to our all goals. So I encourage a lot that everybody should work together. There should be no monopoly. Everybody should share and learn from this experience. Maybe you need them, so you should take them. Maybe you don't need them, but they should have the expertise and build capacity by sharing other people. And this is what we are pushing. I would like other institutes to help. Now we are looking for Sidra mainly and Weill Cornell to help us in having more capacity for the lab testing. And I hope that they can handle it. We are discussing them yesterday, and we hope that Sidra and Weill Cornell mainly and Qatar University can help us in this thing. We asked Weill Cornell students to come. We are waiting for the Qatar University students to do the same, like Weill Cornell. But as you know, the problem is big. So the Weill Cornell give us only 9 people. 9 people working 2 days a week is not enough. You know, they are sharing. They are by participating, yes, but they are not participating enough with this huge number of thousands of volunteers to make the big effect. It's good for their training, for their experience, but not changing the game, not game changer in our efforts against COVID, but the big value for them as training.
Okay, thank you very much. Anybody want to add on this? I think that's it for Dr. Mohammed. Question with regards to vaccination, it was mentioned we need to get 70% to be more effective for successful control of disease. But even well-established flu vaccine only have around 60%. So it is highly ambitious target. This is from Muhammad Al-Kalatingal. He is just giving an opinion. I think this vaccine issue is it's been a question for so many questions here asking about this vaccine, and some related question to this. He's asking if the vaccine will be available, who will be prioritized to be given to the police officer, to health workers, to the old people. So anybody can give a view about this issue. Dr. Mohammed, please.
I would like others to share, and then I will speak. I would like others to participate. I cannot.
Yes, please, Dr. Laith, Dr. Nico.
Yeah, so so in this regard, no, I think having a vaccine with more than 60 or 70% efficacy is not actually very ambitious. I think it is definitely doable. It's different from flu vaccine. Flu vaccine usually is designed without knowing which strain will be circulating in the next year. So this is part of the problem in having a vaccine with high efficacy. For this virus, however, we know exactly the strain that's being co-circulating, and so far from the molecular sequencing studies, we see not much mutations in this virus. It does not appear that the virus is changing much. With these considerations, I think it's likely to be feasible to have actually a vaccine with high efficacy, inshallah.
Very good.
So if I may comment on that, as Dr. Laith mentioned, that it's a little bit difficult to compare the influenza virus to coronavirus because influenza virus mutate much faster, although they are both RNA viruses, but still influenza virus mutate much faster, and this is like why there are some strains that escape the vaccine-induced immunity. The other thing that's really important is that the approaches that are being used to develop a vaccine for coronavirus are a little bit different than the influenza vaccine, because most of the influenza vaccine are inactivated vaccines, and some of them, they don't have adjuvants, so there's no good boost to the immune system. So with the coronavirus vaccine, they are using different approaches, and hopefully that will enhance the immunity induced by these vaccines.
That's great. Okay.
Maybe I can quickly add, I think there are two numbers mixed up. One is vaccine efficacy and one is the percentage of population that needs immunity. So at the end of the day, it may be a mix of immunity from natural infection and vaccine induced. So you can, even with not so much efficacious vaccine target at risk populations, and still be successful.
Okay. Any other notes? No, I think. Let me ask this question. This is from Dr. Fuad Hassan. Good afternoon. Regarding the current national protocols addressing COVID-19, including focus on Qatar Airways, may I suggest a public health tool, Head-on's 10 countermeasures matrix, which will be able to address the loophole, weak spots, links in the system. Thank you, Dr. Fuad Hassan. I think this is for management, or for anybody want to address this regarding focusing on Qatar Airways. Any of the panelists can discuss or address this question if he like to. There is another question has been going around. Are there different strains of COVID-19? Dr. Abu Raddad and Dr. Ali, this has been going in the market for a while, in the news. Are there different strains of COVID-19, you think? And what's their impact on health, on vaccination, on testing?
Yeah, so yeah, I think in this regard, we have now multiple studies looking at, to sequence the virus, including, in fact, studies a study ongoing right now here at Weill Cornell with my colleague Joel Malik. So there are definitely strains. So we are able to distinguish if this strain is coming, let's say, from Europe or China and so on. But still, overall, the changes in the genetic, in the RNA are quite small. So it's unlikely these have public health implications. So it's unlikely, for example, that the virus that's expanding in New York currently is more, let's say, lethal than the virus that was spreading in China.
Mm-hmm. Any of the panelists want to comment on this? Dr. Ali, you are muted. Can you unmute yourself?
Sorry.
Yes.
Just
yes.
to add to that, what Laith just mentioned, I think what we know, there are two strains, the S and the L strain, and probably from the sequencing happening everywhere now, including Qatar, probably people, they would know how many strains so far being circulating. People, they talk about the strain that started in China, and then maybe the different strain in Italy, and with the US, what kind of strain now circulating. So yeah, so definitely there are more than one strain circulating, but this is very evolving and very dynamic. You cannot say right now how many strains exist, because the disease is just spreading and evolving every day. So people, they have to wait to know when the dust settle, how many strains really circulating so far.
Okay.
We have to be really careful when we come to that. At this point, it will be just a guessing game until all the sequence data come out.
So, Dr. Nico, if there is so different strains, how is that going to affect vaccinations, treatment, testing? Is that going to be a problem, or what do you think?
So I want to start first with saying, mutation in virus is actually a very natural event. So this, you see that with many viruses at different extents. So there are also reports of patients with genetically different viruses in their throat and their lung. There are a few cases from these clusters that they reported out of Munich, which came originally from China. So it's something that just happens. Viruses do mutate, and it allows us to track viruses epidemiologically, but it doesn't necessarily mean one is more pathogenic than the other. So far, it doesn't look like that we're expecting that they mutate so fast that suddenly there are two serotypes, so to speak. So if that would be the case, yes, they would need different vaccine approaches. But as Dr. Hadi mentioned, as coronavirus are not influenza viruses, and these high mutation rates are more features of viruses like flu, influenza virus, or HIV, for example. So the hope is, although nobody knows that, there may be one or two vaccine approaches that hopefully help.
Okay, thank you so much. I have another question from Dr. Munir Tag. The FDA approved chloroquine and hydroxychloroquine to treat COVID-19. Are we planning to prescribe these in Qatar? Are they in use? Probably one of the medical doctors who can answer this question, or Sheikh Mohammed Al-Thani, if he's available.
Yes, I'm available, but can you answer a question? Repeat the question a little bit, please, sorry.
Yeah, doctor, he said the FDA approved chloroquine and hydroxychloroquine to treat COVID-19. Are they prescribed here in Qatar, or are they planned to be used?
Yes, I clarified earlier that we're using hydroxychloroquine. We are giving the main thing that we are giving corticosteroids. We are giving oseltamivir, giving hydroxychloroquine, and we are giving antiviral drugs for HIV, antiviral drugs all together. And you can see till now, alhamdulillah, we are having around 800 cases, only maybe, God forbid, around 16 in the intensive care, 2 deaths. And I think we are doing somehow the logic. We are, God forbid, the death rate in Qatar is more than 0.25% till now. And the intensive care people, most of them are getting in and out most of the time. I hope it's effective, and we're giving interferon during the ICU. So these are the main things we are doing. We are hoping that it is effective till now with people, and we bought more from this hydroxychloroquine, and we hope that it's enough to bring more very soon.
Very good. Okay, there's a question from Sergio Corvella. How many Qatar local COVID sequence? Any comparison with other worldwide sequences? Thanks so much for the great and very informative presentations. She's asking about if anybody sequenced COVID-19 here in Qatar. Dr. Hadi?
So we are working in collaboration with the HMC and we'll coordinate to sequence viruses. So far we had like full genome sequence of 24 viruses. We did it last week, and we plan to expand the sequencing to cover like hundreds of isolated strains in Qatar. So we are working on that right now.
That's very good. That's very good. From Anonymous also, despite the very strict measures of quarantine and social distancing firmly implemented, the number of positive cases is increasing worldwide in many countries. Does this suggest the virus is spreading by other means? So this is a question for all of the scientists, if they have any ideas.
Yeah, I can take on this question.
Dr. Laith, please go ahead.
Yeah, so no, it's actually not, it doesn't mean that it's spreading by other means. It's just simply, it's a very infectious virus, which has a lot of epidemic potential. The social distancing measures that have been introduced are reducing this transmission, but not to the extent that's actually sufficient. Also, many of the national responses have been actually delayed. I mean, here in Qatar, fortunately, the response was very rapid. But in some countries like Italy and the US, it took them really a while before actually they started real good social distancing measures. So the virus was already spreading for several weeks unchecked, and so it became much harder to contain. So it's not true. Actually, the social distancing measures are working and very, very well. It's just simply, it is so ferocious, the virus, that it's very hard to contain. This is why we need to maintain these social distancing measures. Possibly even in some countries, they may need to be even scaled up to reduce the contact rate sufficiently.
That's very good. Anybody, Dr. Ali? You are muted. You are muted, Dr. Ali. Sorry.
I think you mute me, but anyway. So just to add to that, yes, we know the current evidence that the transmission is from person to person, especially in close contact from respiratory secretion, or what we call it droplets, and that's well known. So the second method also by contamination of surfaces, that's also well documented. Then people, they talk about airborne and aerosol transmission. This has been shown only in controlled environment in a lab. Could happen, for example, if the virus get aerosolized, let's say from being in close contact with a patient under intubation, manipulation, and so on. That could happen, but we don't have evidence that happened in the clinic, but only in controlled environment. From one study that came in New England Journal of Medicine, I think they showed that. Hadi mentioned earlier in his talk, Dr. Hadi Yassin, when he talked about rotavirus and contamination of fecal matter. The virus has been shown to be present in the fecal matter. Could that also be aerosolized? And especially in children, if the hygiene is not sufficient, that could happen also. But the well-known method of transmission, person to person, and also in contact with contaminated surface. This is a well-documented one.
Okay, thank you. We'll have one or two more questions and then we'll be done. We'll be close to the one. So one of the questions, it says, is it possible for a recovered patient to spread the virus after leaving the hospital, just like others who might carry the virus while showing no symptoms? Yeah, and somebody recovered. Is he going to be still infectious for others? What do you think, Doctor? Dr. Nico, or Dr. Ali, Dr. Abu-Haddad?
Yeah, no, it's really very unlikely. In fact, right now, what we have seen, even including in fact here in Qatar, by doing the swabs and measuring viral load, so people may have viral load, some viral load, even quite a long time after the onset of infection, but it's so low, it's unlikely to be infectious. So that, I mean, a short answer, no, the infectious period, in fact, quite likely to be small. We have recently a study published in Science that even estimated it only to be 4 days on average. But of course, there is a lot of variability. Some people carry the virus for longer time. No, it's what is really more concerning is the role of asymptomatic infections in spreading the virus rather than any infections coming from recovered people.
Okay.
So if I may add to Dr. Laith, I think like in HMC, they test them twice, and if they are negative, they release them. So they don't release them unless they know they are already like there's no virus in the sample. That's number one. The other thing is related to the question I asked to Dr. Mohammed Al-Thani, because there are some reports, although they are not scientific, saying that the virus could reinfect the same patient second time, although they don't develop symptoms. If this is true, they could be a source of transmission. So although they are infected the first time, they show symptoms, they get infected the second time, they don't show symptoms, but they could be a source of transmission. And that's something to consider and look for in the future.
Yes, I would like to mention, just as public health, the scientists are smart people and they go investigate everything, and it's something healthy for to keep upgrading the humanity. But at the same time, things should be going in the logic matter. The challenge with the people now, they are reading the rare papers more than they're reading the common papers. So people we are having overwhelming system running behind Mirage, where we cannot do everything to make people happy. Example. Now we are putting people 2 weeks in the quarantine, getting from negative test and recommending for them to stay 7 days in home after the quarantine. But the challenge to give 21 days, but somebody say, what if the case have appeared from the rare cases after 21 days? I cannot keep people 2 months in their home because maybe after 21 days, they can have the disease. It will frustrate the system to people to live normally. The second thing you mentioned, the study that we are reinfected. The studies say that it's not reinfected, it's the disease was still there, and it was a little bit like hibernating or quiet. It didn't go totally, and test negative, but it's still there. And people think he was reinfected while the virus is still there. He didn't get the infection again soon, but keep people in panic that this is the super virus that we can never get rid of it all of the time. And we cannot use the people with immunity to work in the country because they can be vaccinated. This is another challenge. The third one is saying that the virus stay in the air everywhere, and these people cannot work. It make every person going to his work, even with the mask, he's afraid, and we cannot be productive. For the time, in one sentence, I say, I will look for everything, but if we go for everything written by scientists, the system will not work in the world and will be in a more chaos and overwhelming system.
Thank you very much, Doctor. Thank you all. The last question, everybody asking this all over the world. When did you think, guys, this crisis will finish or end? Any speculations from the world study? Dr. Abdullah Al-Thani, please. Dr. Mohammed Al-Thani, please. Can you give an estimate when do you think this crisis will finish?
If yes, for me, I would like to speak a bit more detail. You know, people in Qatar, they think that this will finish in 2 weeks, you know, that we're going to stop and we'll travel very soon. And they should be prepared that this is a long term. It's the first time in history everybody is locked down. The country will take time to even remove the lockdown from their countries, because like even China now, they are afraid from people coming from Europe, you know, things are changed now. This will take a long time because even after quite maybe in the summer, it will start in the winter of the other countries in the south hemisphere, maybe it will be higher. the same thing after the summer. The WHO say that there is another peak will happen after the summer. We are hoping that the vaccine or a proper treatment will relieve the world, but I don't know exactly the pharmacy company what they are planning to find the best way, maybe to sell plasma of people like everywhere in the world, or to have a treatment, or the vaccine. These are the three things that can be a game changer for now. Other than that, the world should slow down and take cases, accept cases, because there was some myth that we can control the disease for zero, and what happened in China, which is not correct. I don't know what exactly did China to get to these results. Maybe something that we cannot accept as human people, but it looked like in Europe and America, it's not so easy to control the disease. But the case will keep coming on. But if the system is not overwhelmed, we can keep treating them. And the deaths, I think, from them in the end of the year, I hope so, that will be very low and less than what people die from car accidents usually in the same year.
Sure, thank you. Any of the panelists want to comment anything before we close our session?
I think it's only one point that I want to talk about.
Yes, please, Doctor.
I think it's a question of just when this havoc will just, ended, or just, what other type of vaccines were going to be used for young as new vaccines, or what about the protection from this virus? I think that it's not high time to talk about that unless you have to go through the biological characteristic of the virus itself. It's the most important thing, and it's not just a time just to talk about all these things unless just we see how things will go. Given that it is a single-stranded RNA virus and that is released by budding, that all the time that it replicates in a host system, that it attains its all host characteristics, so it can have the possibility of sharing what cross-reactive, what you call it, the receptors all the time, so it can develop the infectivity here and there. So I think that it is, people have to, to wait, till just you go all the characteristics of this virus and what's going on, how many serotypes are in the way, and then after that, just you can talk about all other things.
Okay, thank you very much. I think it's almost one, and unfortunately, there is lots of questions. It's about 50 questions, but we cannot answer all of them. Any of the attendees who want to forward the question to any of the scientists, he will answer it for him later. I would like to thank you all for making this seminar very successful. Dr. Sheikh Mohammed Al-Thani, thank you so much. And I think this crisis, we will all beat it, inshallah, together. Everybody have a role, like Dr. Mohammed Al-Thani mentioned. Every person have a role to defeat this enemy. And I'm sure we will defeat it with the least cost and with the least casualties as soon as possible. Thank you so much, and God bless you all. Yalla, salamu alaikum. Okay.